Anemia diagnosis. A complete blood count, CBC, test will measure your red blood cells, hemoglobin, and other parts of your blood. Your doctor will ask about your family history and your medical history after the CBC. They'll probably do some tests, including 1. Blood smear or differential to count your white blood cells, check the shape of your red blood cells, and look for unusual cells. 2. Reticulocyte count to check for immature red blood cells. Anemia treatment. Your treatment will depend on your type of anemia. 1. If you have aplastic anemia, you might need medication, blood transfusions, in which you get blood from another person, or a bone marrow transplant, in which you get a donor's stem cells. 2. If you have hemolytic anemia, you might need medication that will hold back your immune system. 2. Your primary care doctor may refer you to a doctor who specializes in vascular problems. 3. If it's caused by blood loss, you might have surgery to find and fix the bleeding. 3. If you have iron deficiency anemia, you'll probably need to take iron supplements and change your diet. 4. Sickle cell anemia treatment includes painkillers, folic acid supplements, intermittent antibiotics, or oxygen therapy. 4. A drug called hydroxyurea, Droxia, Hydria, Cyclose, is often prescribed to decrease sickle cell pain crises, complicated mechanism. 4. The medication called voxelotor, Oxbrita, can help your red blood cells keep their proper shape. 4. Crizanlizumab TMCA, Adakveo, can keep blood cells from sticking together and blocking vessels. 4. L-glutamine oral powder, Endari, can cut down on your trips to the hospital for pain and also guard against a condition called acute chest syndrome. 5. If you have a vitamin B12 or folate deficiency, you will be prescribed supplements. 5. Thalassemia doesn't usually need treatment, but if your case is severe, you might have blood transfusions, a bone marrow transplant, or surgery. Anemia diet. To treat anemia, eat an iron-rich diet. If you don't eat enough iron, your body can become iron deficient. Some foods that have high amounts of iron include 1. Meats. 2. Eggs. 3. Leafy green veggies. 4. Iron-fortified foods like cereals. 5. Beans. 6. Seafood. 7. Peas. 8. Nuts and dried fruit. Lentils. Anemia home remedies. Eating a diet with iron-rich foods is one way to treat your anemia at home. Anemia supplements. You can also take supplements, which will increase the amount of iron and hemoglobin in your body. Ferrous sulfate comes in liquid and tablet forms. Usually, the serving size is 325 milligrams. Talk to your doctor about taking an iron supplement for anemia and see how they recommend taking it. But typically, you'll want to take it on an empty stomach. Don't combine your supplement with milk, caffeine, or calcium supplements. It may help to increase absorption to take your supplement with vitamin C, such as a glass of orange juice. Anemia complications. Anemia can lead to severe tiredness, making it very hard to get through your day. It can also lead to an arrhythmia, or irregular heartbeat. Because there isn't as much oxygen in the blood, the heart must pump more, which could lead to heart failure. Anemia can even be fatal, especially if you lose a lot of blood too quickly. Anemia and pregnancy. When you get pregnant, your body goes through many changes. Your body produces 20% to 30% more blood, which means you need more iron and vitamins. A lot of people don't have enough iron for their second and third trimesters, which could lead to anemia. While mild anemia is normal during pregnancy, severe anemia could put your baby at risk for anemia as well. If you're severely anemic during your first 2 trimesters, you're at a higher risk of having a preterm delivery or a baby with a low birth weight. People who are pregnant and anemic are also at a higher risk of blood loss during labor and may have a harder time fighting infections. During pregnancy, you need 27 milligrams of iron each day. You can take prenatal vitamins that contain iron to help prevent or treat an iron deficiency during pregnancy. Your doctor might also give you a different iron supplement. You can also eat more iron-rich foods to help with your iron deficiency. If you do these things and still have anemia, your doctor might suggest testing to find other potential causes. If your anemia is due to iron deficiency, they'll have you take more iron supplements. But if you had a history of gastric bypass, small bowel surgery, or you aren't able to take an iron supplement, your doctor will give you iron through an IV, intravenous